Hello, and thank you for watching this product training video. My name is Kristen Semino, and I am the Small Group Product Manager at Blue Cross and Blue Shield of Nebraska. Throughout this presentation, I will speak to changes on Blue Pride, our small group ACA product, Blue Flex, our level funded product, and Blue Freedom. Most of the changes are effective January 1st, 2021 contract years and after. If a group is renewing or joins Blue Cross and Blue Shield prior to January 1st, they will not see most of these changes until they renew in 2021. During this presentation, I will walk through many different changes from legal state mandates to form updates to cost share changes between 2020 and 2021. Again, everything discussed in this presentation pertains to Blue Pride, Blue Flex, and Blue Freedom only. Some changes are applicable to other product lines such as large group, and if you also sell those other product lines at Blue Cross and Blue Shield of Nebraska, please reach out to your Blue Cross and Blue Shield of Nebraska sales and account management team to learn more. These are all the known product updates at this time. There is still an opportunity to enhance some documents and forms we provide prior to January 1st. And if any changes occur, we will communicate through a broker update or our sales and account management teams. This section explains any state mandate changes or ACA required changes. Due to the pandemic, Nebraska legislature was temporarily closed. As the session has resumed, a few bills were recently passed. We are evaluating their impact on our products and determining next steps. We will communicate any updates to the market in a broker update or through our sales and account management teams as information becomes available. Each year, we analyze our plans to comply with mental health parity standards. We have greatly considered the feedback from the market on our current cost share structure for the mental health outpatient office visit benefit. Effective January 1st, Blue Freedom PPO plans will move to a plan pays 100% cost share for the outpatient office visit and services benefit. All qualified high deductible health plans will remain deductible and coinsurance for this benefit. Blue Pride and Blue Flex will still have the same cost shares for this benefit as they did in 2020, which is deductible and coinsurance, even on PPO plans. Again, the change here is only on Blue Freedom, and it is effective on January 1, 2021 contract years and after. After further evaluation of the autism spectrum disorder state mandate from 2015, we are removing the age limit on this benefit. Previously, treatments and services related to autism spectrum disorder were covered up to age 21. Now there is no restriction on the age. The covered services list did not change. However, we will allow the services at any age to be covered under this mandate. We have made updates to reflect this in the contract, the certificate of coverage, the summary plan description if applicable, and the SOBs. This slide depicts the ACA out-of-pocket limits for PPO plans. In 2021, the individual limit increased by $400 and the family limit increased by $800. For 2021, the new individual maximum out-of-pocket is $8,550 and the family out-of-pocket maximum is $17,100. Though this increase did occur, we did not change all plan designs at the current maximum to the new 2021 maximum. We will review plan design changes later on in this presentation. Here is a comparison of the 2020 to 2021 healthcare spending account minimum and maximum limits. These are applicable to qualified high deductible health plans. This shows the deductible ranges, out-of-pocket minimum and maximum limits, and the maximum allowed contributions to HSA accounts. This next section will highlight additional enhancements we have made to our products. We will no longer have a penalty applied to pharmacy out-of-network claims. The out-of-network pharmacy claims are extremely low due to the broad networks we offer. Claims submitted by members using an out-of-network pharmacy will now apply a 50% coinsurance, and, if applicable, the out-of-network deductible must be met first. There are 3 variations in the small and mid-sized group plans. We have some prescription plans that have copays on all in-network tiers. The out-of-network cost share on those tiers is just a 50% coinsurance. If the prescription plan has a hybrid design, with some tiers having a copay and some tiers having deductible and coinsurance, then the tiers with a copay in-network will have an out-of-network benefit of 50% coinsurance, while the tiers with in-network deductible and coinsurance will have to meet their out-of-network deductible, and then a 50% coinsurance will apply. If the prescription plan has deductible and coinsurance on all in-network tiers, then all out-of-network tiers will need to meet the out-of-network deductible before a 50% coinsurance is applied. In 2019, we modified the exclusions for services provided at employer-sponsored health fairs and employee work sites to be excluded unless approved by Blue Cross and Blue Shield of Nebraska. However, for all small and mid-sized group plans, flu shots and the administration of flu shots will now be covered when done at the work site without prior approval. It is important that employers select a provider that is in-network for all of the networks they currently offer to their employees. Annually, Amwell makes changes to its fee structure. When a member is on a qualified high-deductible health plan, they pay the price of the office visit until the deductible is met. This slide is just to make you aware that members on a qualified high-deductible health plan will go from paying $54 for a visit upfront until their deductible is met to $59 effective January 1, 2021. PPO plans are not impacted by this because their office visits have a copay. Again, this is effective January 1, 2021, regardless of the plan's effective date. The next few slides are great high-level visualizations of the changes we just discussed and what product lines and documents have been impacted. As you can see here, there are the product changes I just explained, and the columns to the right notate which product the enhancement is applicable to. This is a quick guide to reference each change and the applicable product line. Again, the mental health office visit change is only applied to Blue Freedom groups effective on January 1, 2021 contracts and after. This slide shows what legal documents have been impacted by each of the product changes. The Blue Flex product does not have a certificate of coverage, and the Blue Flex changes are instead reflected in the summary plan description document. Though the summary plan description document, or SPD, is customized to the group, please reach out to your account management team if you need a generic copy of that SPD. The next few items show updates to the Schedule of Benefits summary documents. We have added a few items to help guide members to understanding their benefits better. Preferred Centers, formerly known as Centers of Excellence, is not a new benefit. However, we did not call this benefit out or explain it previously on any of our products' Schedule of Benefit summaries. This now provides additional information to our members on this benefit. Note that only on PPO plans can we waive the deductible and coinsurance. On qualified high-deductible health plans, we only waive coinsurance. The member is still required to satisfy deductible amounts. As mentioned previously, Blue Freedom PPO plans will have mental health outpatient office visits covered at 100% effective on 1/1/21 contracts and after. This is how it will show on the SOB. All other products, Blue Pride and Blue Flex, will show deductible and coinsurance still in the highlighted field. Here is how the out-of-network pharmacy cost share changes will look. Again, if it is a PPO plan with copays for the in-network tier, then the out-of-network tier will just be 50% coinsurance as shown. If the in-network tiers have deductible and coinsurance cost shares, then the out-of-network tiers will have to meet the out-of-network deductible before the 50% coinsurance is applied. In efforts to help members easily identify their plan's pharmacy network and prescription drug list number, we have added this section to the bottom of the prescription drug plan SOB. The fields in yellow are variables by product line, but are consistent across all plan options in the same product. Meaning, all Blue Freedom plans will show the same prescription drug list number and the same network letter. We have not made any drug list number changes to our network changes on our product lines for 2021, with the exception of Blue Pride. The ACA product requires annual updates to the drug list, and so groups with 2020 contract years will move from PDL 63 in 2020 to PDL 64 upon renewal in 2021. The Centers for Medicaid and Medicare Services required changes to our Summary of Benefits and Coverage documents for 2021. The changes are minimal and are required of all health plans. The first update shows a sentence with a link being added to each page of the SBC document. This link is to the Certificate of Coverage. The link on the SBC for Blue Flex will be slightly different since it does not have a certificate of coverage. Blue Flex members instead receive a summary plan description, and it is custom to the group. Because of the customization, we cannot link the actual group-specific summary plan description on the SBC. Instead of a link, the statement here on the Blue Flex SBC will refer employees back to their employer for plan or policy documents. The second change outlined here is a small update on this question regarding minimum essential coverage. You can see the differences between the current 2020 language and the new 2020 language here. This is not all of the changes to the SBC document. However, these are the most noticeable changes, and we wanted to share these with you in this presentation. Now we will move on to the 2021 updates to the Master Group applications. Again, these changes are applicable to Blue Pride, Blue Flex, and Blue Freedom. Not all changes are on each product line, which I will clarify as we walk through this section. Our focus for 2021 was to get the Master Group applications, or MGAs, to follow a similar format and flow. The previous versions all contained the same basic information, but labeling and formatting were different on each one. Some noticeable changes are a section that is for the account management and sales team to complete, and a new vendor section with no new information, but it is now separated out from a previous heading. And the biggest change is the Authorized Plan Contacts, or PHI, information page for Blue Freedom and Blue Flex. Now, all MGAs will follow this new format. As you can see, there are product-specific sections that contain variability. The other sections are very consistent across product lines. Blue Pride does have a few differences due to the fact it follows the information requested in the small group portal. As you can see, Blue Pride is the only product that has the Authorized Plan Contacts information still part of the actual MGA. The other two products now have a separate form, not part of the MGA. We will walk through that in more detail in a few slides. Here is an image of the internal use only box. Many of these fields were often left blank by the broker or group, and it was determined that this information are often things we already know internally or need to prompt the broker for. This is the vendor information section. Again, this information is not new. However, we pulled it into its own section for clarity purposes. The enrollment and eligibility sections are product line specific. We did make some changes to the Blue Pride and Blue Flex sections. They are identical, except Blue Flex does not have item D. We removed some options in A that were rarely used. If those options are still requested or needed, the broker should just utilize the other field. For Blue Freedom, we made similar changes and eliminated some options that are truly not available to the group in Section A. The plan design sections are also product specific. We did some annual updates on all of them and then made some enhancements that make it easier to complete and provide the information truly needed. Blue Pride and Blue Freedom have only minimal annual updates to this section. For Blue Flex, we removed the prescription options since they are already paired with medical plans. They cannot be chosen like on Blue Freedom. We also added the disclaimer in the yellow box about the prescription options already being tied to each medical option. For Blue Pride, we updated the charges and employer contribution section to look more like the small group portal. There is no need to list out all of the cost shares for contributions by tier because the small group portal only asks for the percentage of the single membership rate. As a reminder, the Blue Pride MGA is a simple tool for brokers to gather information. All MGAs for Blue Pride groups are filled out electronically and submitted via the small group portal. For Blue Freedom and Blue Flex, there are no changes to the language at the top. However, we reorganized the membership tiers to follow the tiers on the renewal outputs and quotes. Then we added 2 boxes for the employer contributions on the dental plans. Previously, the Blue Freedom and Blue Flex MGAs had this section built in. Now we have removed this from the MGA and this form will be completely separate. This allows us more freedom to update the group's PHI easily throughout the year and will help us house this information all in one place so we can provide a master list to the group at request when needed. This form will follow the same schedule as the MGA, meaning the group will need to complete it at new sale along with the MGA, and then each year at renewal we will ask to validate and update any changes along with the new contract year master group application. Note, all of our forms often have fillable versions available online, and they should open and be completed in Adobe for optimized use. This section walks through the 2021 cost share changes for Blue Pride and Blue Freedom products. We did not make any cost share changes to Blue Flex plans for 2021. We are introducing a new silver high deductible health plan for Blue Pride in 2021. The goal of this plan was to get an option closer to our bronze plan that fills the gap between our current 2020 lowest silver option and our 2020 bronze option. This plan falls in between current SHB 20 and BHA 20. If you are newer to Blue Pride, our naming convention is fairly simple. The first letter identifies the metallic tier. The second letter is either H for high deductible health plan or P for PPO, and then the third letter is a rank of the deductible amounts. So this new plan SHC 21 is a silver high deductible health plan with the highest deductible amounts out of all the other silver high deductible health plans we offer. Due to annual changes in the ACA tools and feedback from the market, we did make some small updates to 4 other options. Here are year-over-year comparisons for the 4 options we changed. GPA 21 has an increase to the coinsurance and a couple copay changes. On SPC 21, we did reduce the deductible amount and added coinsurance. Then GPC 21, we increased some copays slightly. And last, for BHA 21, we did increase the limits to the maximum allowed amounts for 2021. For Blue Freedom, only 5 plans have cost share updates for 2021. The red shows the new 2021 cost shares. We evaluated the 4 plans we added recently in 2020. Though one has good adoption, 3 others did not, and we attributed that to the fact they did not have copays on key cost shares. As you can see here, options 67 through 70 all now have some copays added, from PCP to urgent care. We also changed the coinsurance on option 69 and option 70 to 50%. Based on broker feedback earlier this year, we did move option 66 to the new 2021 maximum allowed amount for qualified high deductible health plans. Current option 66 groups will have the opportunity at renewal to change to a different option if they do not like the increase in deductible and out-of-pocket max amounts. There are a few known updates to the 2021 underwriting guidelines. However, this list is not complete, and there may be additional changes. The final versions will be available on our website no later than October 1st. As you will see, any major changes will apply to new business, and current groups are grandfathered. On all product lines, Blue Pride, Blue Flex, and Blue Freedom, the required minimum hours worked to be eligible for coverage is now 30 hours per week. Previously, Blue Freedom and Blue Flex required a minimum of 17.5 hours worked. Those groups are grandfathered and can remain the same. On any new group sold after January 1st, 2021 and after, we will require 30 hours per week in order to be eligible for coverage. Effective immediately, no specific medical conditions are listed in the Blue Flex underwriting guidelines as they were in previous versions. We will not have a specific decline list of conditions that would automatically eliminate a group from getting a Blue Flex quota renewal. Each group will be specifically evaluated in the underwriting process based on all rating factors listed in the guidelines, including ongoing medical diagnoses or conditions. We recently republished the 2020 underwriting guidelines with the language on the slide, and it was sent out in a recent broker update. We also added language about our refund procedure, as well as coexisting medical coverage on all underwriting guidelines. There is currently a reinstatement of coverage section that explains procedures when a group fails to make necessary payments. However, we updated the information to be more consistent and clear across product lines. As I mentioned earlier, there is the potential for more changes before the underwriting guidelines are published October 1st. They will be communicated by our sales and account management teams, but please review the published 2021 versions in detail. This next section will walk through some updates coming soon for the reporting component of Blue Flex and a refresher on the wellness benefit. Currently, we house all Blue Flex aggregate reports on a website available to you, the broker. Existing coverage groups will continue to have reports available on that website. Reach out to your account management team if you do not have access or have any questions regarding that process. Going forward, we will begin to provide these reports directly to the broker and general agent versus them being published on the current Blue Flex reporting tool website. Groups with effective dates of September 1st, 2020 and after will have reports distributed directly from Blue Cross and Blue Shield of Nebraska. The first reports for the September 1, 2020 groups will be available mid-October. The process for how these reports will be delivered to our brokers will be communicated in a broker update in late September, early October. Please watch out for an email with more information. Eventually, all groups, regardless of the effective date, will move to the new report delivery method. For now, we will just have groups with effective dates of September 1st, 2020 and after on this new process. If a group is renewing September 1st, 2020, the previous 2019 contract year report will still be available on the website, and the broker will still have access to the reports. With many groups moving to a work-from-home situation the last 6 months or so, we have recently seen increased participation in our Blue Flex Wellness program. However, we also learned that many group leaders did not know this was a free part of their healthcare coverage and that rewards are available to their employees. Though there are no major changes to this part of the product, we wanted to revisit the wellness program and show some changes to the look and feel of the platform this program runs on. Effective January 1st, 2021, there is a new platform or website this program runs on. All links and websites currently used will redirect to this new page. There is now a mobile app available with gym check-in technology and fitness device integration. This program is still called Blue Health Advantage, but it is now powered by Vitality and the Vitality app. This shows wellness resources that are available to members that allow them to earn points towards rewards. There are also additional educational tools available on nutrition, health, and physical activity. Here are the images of what a member will see when they want to pair their fitness device or smartphone. Again, the new program will run the same way with similar contest structures. The contests are updated annually, and groups will be informed of the new contests later in the fall for 2021. This concludes the 2021 product updates for Blue Pride, Blue Flex, and Blue Freedom. I appreciate you taking the time out of your day to listen to this presentation and learn more about our products. If there is anything we can do to help support you and your groups, please let us know. We appreciate our partnerships with all of our brokers and look forward to another year working together. If you have any questions related to the 2021 changes or any product questions related to Blue Pride, Blue Flex, or Blue Freedom, please email productinquiry@nebraskablue.com. We will gather all questions and responses and publish an FAQ document so all brokers have access to the questions and responses. This recording will also be housed on the webinar section of nebraskablue.com for future viewing. Thank you.